Hello. This is the Dankmeyer Academy presentation for October 2022. And I put together a presentation called The General Principles for the Wood-Cheneau Rigo Spinal Orthosis. We do have the chat box open, so if anyone wants to send a chat through, I have a colleague, Mary, here that can read them to me or alert me that they are going on, because when I get started with my topic, I get very excited, and I would love to answer all questions if you have any. Okay. So on the screen here, I have the very first page of my presentation, and isn't this the most beautiful brace? But either way, anything can have a transfer pattern, but it really comes down to the function. So on this right side picture, I put this up because this pretty much tells you how tubular you see. And this was one of my own that I was delivering, which is why I took the picture from the top down view on that right side. That padded piece right there is underneath the armpit for that patient. So that's underneath the left axilla. And then you can see how it has the rotational features. Okay, let's move on. And I have to move this one on so that I do this. Who is in the name? So it seems like a big mouthful. So general principle is that Dr. Cheneau was able to actually get good general correction of scoliosis when he would plaster cast his patients and place pressure pads and actually hypercorrect the patient in a plaster cast. So it wasn't totally, he cut it off and then build the thermoplastic brace over that hypercorrected mold, and then that's how he was able to get actual detorsion and sagittal plane normalization, which actually corrected both the coronal and transverse planes, resulting in an elongation of the spine within his thermoplastic scoliosis brace. So that's where Dr. Cheneau began, 1979. Then Dr. Manuel Rigo began to work with him and actually put together this classification system that you'll see on the right side. And that was published by him actually to share it with our field in 2010. And the nice thing about him having classifications is he didn't just do it by an X-ray. When he classified them, he had the radiological information that you should see in terms of the L4, L5 counter tipping, and even where the central sacral line should be in regards to the convexities and the concavities. And he also actually put in for us as clinicians to figure out the clinical attributes of the muscles on the spine. So it wasn't just a static picture anymore when he put it together with a classification system. This also actually helped, if you are familiar with Schroth therapy, this also helped all of us work together as Schroth therapy is scoliosis specific exercises to be done, and they can be done inside of the Wood-Cheneau Rigo because we are working on hypercorrective posturings with the convexities being rotated and moved forward. So as we're going to go through on the general principle, you'll see what's required in a Wood-Cheneau Rigo. I'm going to go down one slide. I don't know how to do it. Yeah, use the sorry. Here we go. Okay, so that's the Cheneau part. This is the Rigo part. Here we go. The next person in the name is Grant Wood. And he actually trained with Dr. Rigo in Spain. He was actually part of the published the published publication in 2010 with all the classifications. So he was part of that formulation and brought it over here to our United States. You can read on the screen. He started a company called Align Clinic, and his business model is actually to train clinicians to be in their factual assessment for the modification of the Wood-Cheneau Rigo, even long-term follow-up, but stay within our local community, no longer making patients fly out to California or go to long distances to get to this high quality technology. One caveat is that all my cases will always be fabricated by Align Clinic so that Grant Wood and Dr. Rigo can oversee my quality. And that happens with everyone that is a Wood-Cheneau Rigo certified clinician, which I appreciate because as a CPO, I do more than just scoliosis, and knowing that everything fabricated is fit well, and the details I give to them, if I miss something, they have found it. And they also can write me notes, beware at the 3-month follow-up, at the 6-month follow-up, take a look at these features that might show up, because again, we are correcting scoliosis on a living person that is compliant or maybe not, and of course, the other factors, as we all know, that go into successful bracing. So, but it's nice to have those clues to look for as well. My next slide is to show you where the locations are for the Wood-Cheneau Rigo, just general principle. Locations are, you can see we are here in Linthicum Heights, but it's not where it's in everyone's neighborhood, if you know what I mean. So that's where, knowing that if someone needs access to a Wood-Cheneau Rigo or the technology for three-dimensional correction with the ventral and dorsal void spaces, this would be where they would be directed for a Wood-Cheneau Rigo. The next one is, oh no, here we go. This is our three-dimensional correction, which actually I used to have on a very large poster inside of my clinical rooms. But the derotational forces are within the transverse plane. So in our picture on the right, the blue line is the thoracic forces. So you see where that white pad on the right side and the right thoracic is pushing forward, right? So now think of the rib cage. The rib cage on the right side is now coming forward into that void space. And then therefore, by breathing, then they can expand into the void space in the back. You see the opening where it says the thoracic expansion wording? That's the rotational component. You could do it on yourself right now as I'm speaking. So if you go underneath your right rib and you push forward and around, you can see how the left thoracic would rotate. And then the same thing occurs for the lumbar expansion, but that usually recurs when you have the reciprocation. So in our picture, on the left side, you see those yellow arrows? That's the upward and forward motion on that right thoracic. And then on the tight left lumbar, there's a hold with the open posterior right pelvis, which addresses one, the pelvic strangulation, which is a frontal plane deformity or change, but allows now the full sagittal plane normalization, so you don't get any flat back within a Wood-Cheneau. Let's look at it a different way. General principles as well. General principles brought to a patient that wears a Wood-Cheneau Rigo is that there is elongation that's brought around through derotation of the four segments of the body within the Wood-Cheneau Rigo. Similar to a Schroth is the idea, if you can see here on the left and the middle, this is a quote normal spine. You have your segment of the neck and shoulder, thoracic, lumbar, pelvic, but there are times when the pelvic is rotated away from the lumbar. So therefore it becomes its own block. So you look at the body in terms of pelvis, lumbar, thoracic, and shoulders. And that far right is where I want you to see how you can see the trapezoid shapes, right? The larger side of the trapezoid is what's facing you when you're looking at someone from their back. And the smaller side is what's away from you. And you see the same thing when you're looking at either Adams forward bending test, where you can see the thoracic prominence, lumbar prominence, or pelvic rotation, or also in just your standing posture. So general principles, patient types. Patient types for a Wood-Cheneau Rigo, which is idiopathic scoliosis, a congenital scoliosis, Sherman's kyphosis has been successfully treated, neuromuscular scoliosis, any genetic disorders that relate to a scoliosis deformity because of that disorder. De novo scoliosis, which we just had a clinical meeting over Zoom, but it's adult scoliosis that's caused by degenerative changes. Not that someone had scoliosis when they were younger, but the degenerative changes in their spine are leading to a scoliosis called de novo, and those adults are in pain. And then adults that did have scoliosis diagnosed when they were younger, perhaps were even treated with a brace, now in adulthood are back with a little bit of pain. Notice the idea of an adult's compliance all revolves around pain with any regard to brace usage. So that's our patient types. The next general principle I want everyone to know and understand is that we need to have a referral for the Wood-Cheneau Rigo. And I put in there the good wording, the wording that would really be helpful to not have any loopholes, which reads referral for a Wood-Cheneau Rigo scoliosis orthosis that is a three-dimensional correctional brace that has significant pressure and expansion areas built into the brace, which provides correction in 3 anatomical planes. The referring RX also must come with an X-ray that's less than 3 months old, and the radiological report that would also provide the Risser and Saunders score, which is the bone maturity. These 3 things are required for any insurance to provide an authorization. I also need the current X-ray for fabrication, and I use it in my evaluation also to figure out where the prominence is, would read, and the similarities, and then also for the classification system that Dr. Rigo put together so that I can share what the design I'm thinking of would be best for the patient. You'll read further down that once we do the 1 hour evaluation here on a Tuesday in the Baltimore office, which is always the case, we have our Wood-Cheneau Rigo clinics set up for Tuesdays of every week. The authorization can take some time, but once a financial agreement is reached, the fabrication begins and takes about 4 to 5 weeks for the Wood-Cheneau Rigo to arrive in the office for delivery. All deliveries will be done here in the Baltimore office, and it does take 3 hours to elongate the spine. The patient will don it in a lying down or supine position. We will close it down, have them stand, and that's when I can cut trim lines. There's no cutting of trim lines exactly to the shape of that body until the body is elongated, which occurs within the Wood-Cheneau Rigo. So this is a very custom device for any patient, no matter what age. The next one here, the Wood-Cheneau Rigo Clinic, again, is here in Baltimore every Tuesday. At that appointment, if you want to tell a patient or you want to share with them what you know is going to occur, we do clinical photographs in front of our Align clinic grid. And you can see that in the picture on the right side. We do 21 angles totally, but we must have a bare back with the apical vertebrae are marked and the waist is marked. So that if we have any pelvic obliquity or we have the pelvic translation in a forward bending motion, I can see it also in the picture. We also do a 30-second video of the action of the muscles in a forward bending, standing up straight, bending forward and coming back up again. We always take our scoliometer measurements, and then we have to do our own palpation of the spine and pelvis for any sensitivities, flexibility, and the L4, L5 stacking. And finally, we gather our data for the fabrication by either 3D scanning of the torso that is motionless, or I do cast patients in the elongated posture when they are a neuromuscular case that does not stand. It's very successful still in that outcome too. I just want to say that you see here on the picture of the example for our model, it's very helpful to have a very thin, like bathing suits for girls or women are typically have a very thin stripe in the very back, and that's very helpful. Otherwise, I do utilize stockinette and make a custom shirt with an open back so that I can get all the data the right way. It's much more beneficial to do it well the first time. Here we go. Our general principle of a Wood-Cheneau Rigo scoliosis orthosis is that there is elongation at delivery. So again, I'll say it again because sometimes it's hard to understand, but it's very important that it does take 3 hours for the delivery, but it's always done here in the Baltimore office. They lie down to place on their Wood-Cheneau Rigo. I assist with the location. It's always an anterior overlap closure. But remember, the anterior overlap is not going to be the same for each person. Remember, because the ventral expansion area has to go on top of the side that's pulling back. And that's all determined by the scoliosis deformity that's present in that patient. So you can't say it's always right over left, it's always left over right. You have to know the patient's scoliosis deformity and the corrective features of the Wood-Cheneau Rigo. And if anyone ever needs help, of course, they'll know, I'll write it down for them. But I just want to make sure you know that it's specific to the correction. It's not always the same for everyone. All right. The treatment plan, there's always a treatment plan with the Wood-Cheneau Rigo, even with our adults, although they don't have to last as long in the treatment plan, but I do follow them at a 3 and 6 month time frame. And then after that, it's as needed for like strap replacements or so. But the treatment protocol does require that the wear time is 23 hours worth of time. Kiddos remove it for sports. They put it on again when the muscles are still warm. They don't really need to wait. That way they're not as stiff. And it helps with getting the corrected alignment. The muscles are now balanced as well. The rotational features are not resisted. It seems to be a lot easier for an athlete actually to be able to be more compliant with the Wood-Cheneau Rigo, in my experience, not published in a study, but my experience. Treatment protocols do require an in-brace x-ray after 4 weeks of wear time. Not right away for here for me in my clinic. And it must be given back to me because I can then assess what I see at that date and time after the initial delivery and the compliant wear schedule. And then I can plan future improvements as well. Follow-up appointments are every 3 months to assess spine growth, longitudinal growth, locations of the vertebral bodies within the Wood-Cheneau Rigo, contact sites for the effectiveness for the rotation, and any type of body changes. So in the adolescent population, breast tissue is forming, hips are spreading, things are changing within the body that needs to then be modified back into the Wood-Cheneau Rigo for compliance. Here's our next slide. The other general principle that you can always walk away knowing all Wood-Cheneau Rigos will have an anterior closure. So it's very easy for kiddos to be compliant. This is a 6-year-old patient of mine from the past that was able to show us that she could definitely feed the straps in standing so that they didn't, fall off. Then she would lie down and get the Wood-Cheneau Rigo in the right spot and then tighten down the straps that were already threaded through her shape. And these were her x-rays too. Her diagnostic x-ray and then her in-brace x-ray was able to reveal what correction I was able to place on her spine. But age is not really a factor. You'll see I have a SOSORT poster that I put together in 2019 for a 10-month-old case. And the parents, of course, were putting hers on, but still compliance, correction, everything was present. The next slide is, the general principle that I want you to walk away from is that the Wood-Cheneau Rigo has its own email address, so that there's a group of folks here at Dankmeyer that will make sure that any information sent through will continue to be moved forward. So remember, I talked about a referral, an x-ray, radiological report is always what we need to be able to move any case through in any way. But asking questions, sending information, what can we do? How can we do this? And those types of things, that's wcr@dankmeyer.com. I also wanted to share that there is a wcrbrace.com and a line-clinic.com that are reputable resources that have more current published studies. They are keeping up with the number of clinicians that are certified in the Wood-Cheneau Rigo, that you can find them throughout the United States. So if you're listening to this here and you have a family member out in Michigan and you want to know how they can find a Wood-Cheneau Rigo certified orthotist out there, those are the resources I want you to know. That way you can help bring people to better bracing if they're not finding great success with what they're already using. And then I also wanted to share that the SOSORT posters that I did present to the International Society for Conservative Treatment of Scoliosis are on our Dankmeyer website as well. So you have access to them all the time. This is all the posters that I did present at SOSORT. And again, the website is up at the top so that you can find them yourself, load them up, read them in bigger print and see. But I was able to share publication studies for an Ehlers-Danlos 10-month-old and also for an osteogenesis imperfecta 80-year-old, 82-year-old. So remember, don't get stuck on the idea of adolescence. It could be the genetic disorders or neuromuscular disorders or things like that that lead to scoliosis that would be better off treated with the rotational correction. And finally, I have this last picture here. This is me at SOSORT. So there, of course, when you do publications, I was able to meet and speak with Dr. Rigo. He looked over my SOSORT posters in person so I could ask questions. He did it at 4 a.m. So you really have to get him early. Grant Wood, as you see there, and then myself and other clinicians that are certified in the Wood-Cheneau Rigo as well. So are there any questions about the general knowledge and principles of a Wood-Cheneau Rigo spinal orthosis? You're very welcome. I actually have samples here too, in case anyone asks questions, like to show how big the ventral void can be. Probably would have braced for a pediatric patient. Oh, well, so remember I had a 10-month-old Ehlers-Danlos. She had a 30-degree curve and she was 10 months. So that was going to impede her ability to utilize her chair, to be able to breathe. So remember how we have the void spaces? We're not squeezing anyone into a sausage tube. As long as the ribs have a good connection to the vertebral bodies, that's what the x-ray can tell me. Remember, so you have the vertebral bodies and then you have the rib cage that comes off of it. As long as they're aligned, and that's what I can also tell by palpation, I can work on to see if they would tolerate the rotational correction. So I would say don't get stuck on an age either. If the parents are willing to be taught how to don a Wood-Cheneau Rigo, then it can be done. And I would love for you to take a look at the Dankmeyer website, Evelyn, to see about the Ehlers-Danlos child or infant that was able to have her Wood-Cheneau Rigo. I have it for each of her stages of age. Now, she did outgrow it pretty quickly, as all kids do, but the correction was there for her. I'd have to also say, Evelyn, sorry, if I were to think like what the standard is, if the scoliosis is increasing after all that's been tried, physical therapy, positioning, things of that nature, then I would say, I think it would be worth a consult to move them into a Wood-Cheneau Rigo that would maintain that upright posture with gravity all day and let the kiddo move through the rest of their developmental milestones. Thank you both. Okay, everyone have a great day. I hope this plants a seed of thought and that you feel more knowledgeable about the general principles of the Wood-Cheneau Rigo scoliosis orthosis. That's what I look like the whole time. Sometimes I don't like the way, oh, is it ending?